I'm trying to thank you for the hype me. Welcome. Don't forget to grab your points, guys. Don't forget to grab your points. I'm going to move a little, so bear with me. Here I come. I'm back. Now you have my full attention. You have my full attention, friends. I want to make sure that everything works good for this simultaneously. Marianne, welcome. We are doing this 5 days in a row, guys. 5 days in a row. I'm proud of myself. I think this is day 6 in a row because I did Saturday, Sunday, Monday, Tuesday. Yeah. Thank you. We got this. We're going to keep doing this every day, at least every weekday, even if it's just for 30 minutes. I'm trying to modify my lighting so the other platforms can look as good as I look on TT here, but all right, guys, if you're new here, my name is Josie. I'm a nurse practitioner. I create healthcare content every day, and today I'm going to talk about type 2 diabetes and some complications that can lead to disability if not managed appropriately. So bear with me as I give time for people to join. I'm waiting for some of my besties that are not here. Some of my besties that are not here to join us. Let's give them the opportunity so they can be here. We're going to get into it in just a few. I wanted to change my location today to see if it makes a difference, to see if it brings me more friends. If it brings more friends, the more the merrier. Friends, if you're new here, drop a comment. Let me know that you're here. Let me know that you're here. Mrs. Virgo, welcome. If you're just coming in, that's for you. My name is Josie. I do this every weekday, 7:30 p.m. It's a rendezvous. All right, so today we're going to talk about type 2 diabetes, some complications that can lead to disability. We all have, for those of you who have been with me all week, we've been talking about diabetes and nothing else. Diabetes, diet, complication, causes, treatment modalities, tips to help you manage your disease better and have a better outcome. We've covered a lot on type 2 diabetes this week. So if you have any questions, feel free to drop it in the chat. If you're new to my page, my name is Josie. I'm a family nurse practitioner and I create healthcare content every day on all major social platforms. So you can go check me out, Josie Fongo. That name will pop up. Here you already see my handle. And for those of you who are watching me on different platforms, thank you. I appreciate you being here. If you're new, don't hesitate to do what your heart desires. Engage, invite. I always appreciate engagement and invitations so other people can join us and benefit from what we are sharing here tonight, right? So Lindsay, welcome. I see you. I see you. Welcome to all those of you who have been here since I came on live and you have been sticking with me. I appreciate that. So, without much ado, we're going to jump into talking type 2 diabetes. You know, yesterday I shared that over 38 million Americans suffer from type 2 diabetes. Vicky, welcome. Type 2 diabetes affects over 38 million Americans, and there are many more who have not yet been diagnosed. So think about that. This is a disease process that impacts a lot of people, and most times we find out about it at diagnosis. We don't routinely take proactive measures, or we don't take conscious proactive measures to prevent type 2 diabetes most of the time. And even for some people who have warning signs such as family history, who have risk factors such as obesity, ethnicity, family history, people may not always be proactive in monitoring their blood sugar. It is perfectly okay, if you can afford it, to buy a blood sugar monitoring machine and monitor your blood sugar at least once every quarter. If you are someone who is consistent in going to your doctor for your regular visits, which are recommended to be at least once a year, then your doctor does check your blood sugar during those visits. The normal blood sugar for a healthy adult first thing in the morning, fasting blood glucose should be within 70 to 100 or 110, depending on the lab depending on the lab that the system uses. And A1C, which measures the average blood sugar over a period of 90 days, should be 5.7 or less for a normal, healthy person. If it's over 5.7, but less than 6.4, it's considered pre-diabetic. But once you cross 6.4 and or higher, then you are diagnosed with diabetes. Diabetes affects people differently. Everyone's diagnosis is different. Your doctor may not know the exact cause of diabetes, but we know some contributing factors, such as eating too much processed sugars, too much processed food, too much carbohydrates. All those contribute to developing insulin resistance, which eventually leads to type 2 diabetes. First line of treatment is oral therapy, depending on how high the blood sugar was at the time of diagnosis. But we find that a lot of times when patients are initially diagnosed, some people may be in denial and not stay compliant with their medication regimen, and they will start and stop taking the medication, sometimes because of the side effect. And we do encourage that you do not stop your medication without talking to your doctor first. Please let me know if you have any questions in the chat. If you're new here, we've been talking about type 2 diabetes. Joseph, how are you? Please invite other people, invite our friends so we can reach more people. Let them know that we are here, we are live. Let's connect. Let's connect. Let's tell others we are here so that we can continue our conversation from yesterday and build on what we've been doing all week. Let's connect, let's connect, let's connect. Don't be a stranger. If you are in the hallway, come on in. Don't be a stranger. Don't be a stranger. So thank you for listening. Thank you for being here. As I said, my name is Josie. I'm a nurse practitioner, and I create healthcare content as well as go live on weekdays at 7 p.m. Usually 7:30, but some days I go a little early. I start a little early. Ambassador, welcome. If you're new here, thank you for joining. We're talking about type 2 diabetes, which is a common chronic conditions that affects over 38 million Americans. And This happens when your body can no longer use sugar adequately, and it allows sugar to sit in your bloodstream rather than in the tissues where it needs to be. Did I see a question? I hope I didn't miss any question. Feel free to drop any questions in the chat, friends. The first complication of type 2 diabetes that can lead to disability, which I'm going to touch on, is diabetic neuropathy. It causes nerve damage, and when the nerves are damaged, it can lead to a poor sensation. It leads to numbness and tingling in your feet, numbness and tingling in your fingers. When this goes on for a long time, the feet become numb to the point where if you stepped on a broken glass, you wouldn't feel it. And hypothetically, if a type 2 diabetic patient who suffers from severe peripheral neuropathy, who has experienced nerve pain and nerve damage in their feet, if they stepped on a piece of broken glass, they would not feel pain. They would not feel it because their feet have become numb from nerve damage over time because of uncontrolled diabetes or uncontrolled blood sugar, right? And when this happens, eventually this wound where they stepped on a piece of glass can lead into an ulcer, and then usually there's poor healing because of poor circulation and because of poor nutrients or nutrient-rich blood to the extremities. This wound can develop an infection, which can lead to other complications like systemic infection. So keeping your blood sugar at a targeted range, inspecting your feet every day, paying annual visits to a foot doctor, these are some things that you can do to help prevent this complication, because this can lead to disability. It can lead to loss of digits like your fingers or toes. If you got a cut on your toe that doesn't heal and gets infected, that infection can spread, and sometimes it gets worse to the point where the toe has to be taken off so that the infection does not keep spreading. Always wear comfortable shoes, and always keep your doctor's appointments. Friends, let's engage so we can reach more people. We cannot afford to keep this information to ourselves. If you're just joining, please go ahead and invite 1 or 2 people. Touch my nose on the screen. If you push, just press down on your screen, press that plus sign. You're going to see people who are on, and you can send the live to them so that they can come and join us. Thank you for being here. I appreciate you. We are continuing to talk about type 2 diabetes, the complications that can lead to disability. Okay. So we talked about diabetic neuropathy. J. Nicole, welcome. And the complication of your feet becoming numb to where you could step on a nail or a broken glass and not know it. That one can lead to an infection. That infection can spread, and it can even result in you losing a toe or two. To avoid these things, wear comfortable shoes. Make sure you're engaging and keeping your doctor's appointment. Make sure you're communicating with your primary care doctor. Make sure that you are making those visits to the foot doctor at least once a year, because sometimes it's better to go to the foot doctor. They can help you clip your nails. Obviously, manicure is another option if your manicurists have the licensure to do some of the things that the podiatrist would do. Dwayne, welcome. Mirel, I see you. Welcome. Thank you for joining. If you're new here, guys, please give me a thumbs up. If you're new here, welcome. Dwayne is watching from Guam, USA. Thank you for the hat me. And that is, I I think we're like 16-hour time difference, right? It's already Saturday morning, I believe. Yeah, it's about, yeah, I think we're more than 12 hours time difference. Thank you so much for being here. I appreciate you. So you want to avoid cuts and all that if you have type 2 diabetes and have developed neuropathy, because that's how you can catch any you need to inspect your feet. That's how you can catch anything faster and sooner. Dwayne, check me out. I was able to do all the things that you taught me yesterday. How about that? With the nerve damage, sometimes it can cause pain initially. Okay, time difference is correct, right? Sometimes the pain might be unbearable and you need, thank you, thank you. Congratulations to me. Yeah, so as I was saying, you need to monitor your blood sugar, make sure it's controlled, and you need to keep your doctor's appointment, inspect your feet at least every other day, wear comfortable shoes, go to a foot doctor, make sure that if you step on anything, you catch it soon enough and go to your doctor so that they can put you on proactive medicine to keep you from developing complications. Number two, diabetic complication that can lead to disability is diabetic retinopathy, which causes damage in your retina. Your retina is the part of your eye that helps with light vision. Let me take these glasses off. Maybe I'll see better, or you guys can see me better. I don't like my lighting today. I feel like this lighting could be better. Maybe I should do it like this. Maybe. I don't know. I'll do it like this. I don't know. Yeah, diabetic can cause uncontrolled diabetes can lead to a retinopathy, which is degeneration of the retina and the part of your eye that causes you to see light. And when that happens, it can lead to decreased vision, vision loss. Some people even become blind as a result. That is in on itself a disability that cannot be recovered from, because chronic high blood sugar weakens the retina and the blood vessels that supply blood to that part of the eye. As I mentioned the other day, the when the blood sugar is so thick and the heart is trying to push so hard to get blood where it needs to reach, it can lead to damage of the blood vessels by either the blood vessels pop from too much pressure, or because there's too much sugar, that's not oxygen rich blood that is reaching those vessels. And over time, they die from starvation, or they're scarring tissue because they're not getting continuous oxygen supply. Yep, diabetes really hurts. You get injections every other month on your eye. Oh, I'm sorry to hear that. Oh my God. Sorry to hear that, my friend. But yeah, maintaining your blood, the goal for anyone with type 2 diabetes is for your A1C to be less than 7. If your A1C stays under 7, you avoid a lot of complications. So that's the goal for most patients. Depending on other comorbidities, there are some patients whose blood sugar might not ever come down that low to be less than 7 for their A1C. But for most people, it can be managed to where the A1C is less than 7. And that's where we like it to be, because it decreases the future complications significantly. The treatment options are laser therapy if you have diabetic retinopathy, or injections if cut in time. So Dwayne, you are one of the lucky ones, because yours got cut in time, and now you can take injections every 2 months to help with that. Many islanders suffer from diabetes. What do you think might be a contributing factor to that? What do you think might be? How about this? How about you come up maybe later when I finish with all the main topics, and we just have a discussion so you can share your experience and what diabetes means for you, in your people. How about that, Dwayne? Okay. All right, guys, we are talking about type 2 diabetes and complications that can lead to disability. Obviously, if you can't see, that's a disability. If you cannot walk, if you cannot stand on your feet because of pain, and the pain impacts your quality of life and your daily activity, that is some form of disability, right? The third thing I'm going to talk about is diabetic nephropathy. This is when uncontrolled blood sugar damages the blood vessels in your kidneys, right? When that happens, you develop kidney disease. It can go from stage 1, stage 2, stage 3. These are all dependent on your lab results. So depending on your lab results, is how they are staged. And when it gets to a certain level, by stage 4, your doctor might start referring you to a nephrologist so that you can consider your options for either dialysis or possible kidney transplant if things get worse, if it progresses. For some patients, they even get on dialysis on stage 4. But if it progresses to stage 5, most patients opt for dialysis, because if not, then they are slim chances that they will survive it for a long time, living with stage 5 kidney disease. Guys, show some love. Let me know in the chat way if this information is helpful. Let me know if you're new here. Thank you for the roses. I really appreciate you, friends. Thank you, Mara. Welcome. It's good to see you here. It's good to see you, Mara. I hope everyone is doing great today. So you do not want, we talked about dialysis yesterday, and every day since we've been talking about type 2 diabetes. Dialysis is one of those things that takes a chunk of your life. You need to go at least 3 times a week. Usually when kidney disease progresses to stage 5. Yes, thank goodness you haven't gone to that route. We hope you never get there. When kidney disease progresses to stage 5, usually you need dialysis, and it's 3 days a week. And sometimes your treatment can last anywhere from 3 to 4 hours. That's 3 to 4 hours being hooked up to a machine that is cleaning your blood and giving it back to you. And if you factor in the time it takes for you to get to the dialysis center and the time it takes for you to go back home and your preparation time, you're looking at about 6 hours a day, 3 days a week of you having to go for treatments, in addition to everything else that could be going on in your life. Many go to dialysis, but not many dialysis to accommodate all patients. Oh, wow. Wow. One of our friends is in Guam, and he's sharing that in that area, there's a lot of patients with type 2 diabetes. Some of them need dialysis. Well, not necessarily because of type 2 diabetes, but patients who need dialysis are more than the centers can accommodate. That is sad. Oh my God. Oh my God. Yeah, but dialysis can take a huge chunk of your life, and that in on itself can put you on a disability. Now, not every patient who is on dialysis is on disability or is disabled, but for diabetes patients, from my experience in the past as a dialysis nurse, for most older adults who are in their 60s and have other chronic conditions in addition to maybe an amputation, usually they're on disability when they're on dialysis. Yeah, that is really sad. As I mentioned earlier, the fourth complication that can lead to disability is diabetic foot ulcer or amputation, because when there's poor circulation as a result of increased blood sugar, nerve damage, poor sensation, poor circulation, and then a wound develops for any reason. It doesn't matter if it was a scratch or if you stepped on a broken glass. if you stepped on a nail. God forbid you stepped on a rusted nail, because now that we also have to worry about tetanus. But that wound can lead into an ulcer that doesn't heal. And if it gets infected with common infections like MRSA, which is a common skin infection, staph, infections like that, they can spread. And gradually, they start from your feet and then gradually go up your shin. Before you know it, someone is needing an amputation, because sometimes if it's not caught in time and that infection is already spreading, coupled with poor circulation and the blood sugar not being controlled, it can lead to amputation really fast. Friends, if you're joining me for the first time, my name is Josie. I'm a nurse practitioner and I provide healthcare content every day, as well as go live at 7:30. And tonight we are talking about type 2 diabetes complications that can lead to disability. And the one we are talking about right now is diabetic foot ulcer and amputation. Amputation, usually it's either a foot, a below the knee, sometimes it's your toes, fingers, below the knee amputation, above the knee amputation. I've seen patients who were amputated at their hip. It can be very, very debilitating, right? Friends, if you're new here, drop a 1 in the chat or say yes. If you're new, welcome. Welcome, welcome, welcome. I don't know if that clap is good enough. Nikki, I see you. Rivka, welcome. I appreciate you guys being here. I appreciate you so much. Don't be in the hallway. Please come inside. Invite others. Come inside. Let's sit together. Let's have this conversation. Let's talk about things that affects us or our loved ones and how we can prevent progressive complications. Because once you're diagnosed with type 2 diabetes, that's not a death sentence, right? There's still, your whole life is still ahead of you. Let's say that you're 45 when you got diagnosed today and you're 45 years old. You probably have another 45 years to live, right? Knowing these complications and their end game, what they can lead to, can encourage you to do whatever it takes to keep this blood sugar under control. Because if the blood sugar persists and is uncontrolled, it can lead to other chronic conditions such as hypertension, such as high cholesterol. It can lead to heart disease. It can lead to mobility issues. You do not want that. You do not want that. So let's learn, let's grow, let's continue to share the good news. This is one of the things that doesn't get talked about a lot. Imagine that 38 million Americans are living with type 2 diabetes, or with diabetes in general, I should say. About 38 million or more Americans are living with type 2 diabetes or are living with some form of diabetes. And this is one disease that doesn't get talked about a lot, particularly in terms of prevention, right? Friends, if I'm looking away, it's because I'm on multiple platforms and I'm trying to engage with everyone, okay? I'm not ignoring you, right? The fifth complication that can lead to a disability that I'm going to touch on is stroke and heart disease. This is a cardiovascular disability or neurologic disability, because when the blood sugar becomes so high and it increases your chance of these risk factors, there is sometimes patients just give up. I've been checking my blood sugar 4 times a day. I've been taking this medicine. I've been managing my diet. The sugar is not controlled. Sometimes they'll get discouraged and stop taking their medicine altogether and stop checking their sugars. And then they'll have periods of not taking their medicine consistently, and then periods where they're taking it consistently. And this, if done over time, it can cause damage gradually. Now, the number one thing you should be concerned about if your only diagnosis is type 2 diabetes, know that high cholesterol is not far away. Know that hypertension is not far away. Because when your blood sugar is high, it causes the consistency to change. When the consistency changes, it becomes thicker. And when it's thicker, then your heart needs to push with more pressure to overcome the resistance from the blood being so thick in the vessels. And when that happens, it can break the normal amount of cholesterol that is already in your bloodstream. The molecules can be broken down to smaller pieces. And when there are smaller pieces in the bloodstream, they tend to get stuck and clog and build up plaque, which causes stiffening of the vessels, which causes narrowing of the vessels, and so on and so forth. If I'm making sense, type yes in the chat. Type yes in the chat if what I'm saying is making sense to you. Right? So when the vessels become stiff, when the arteries becomes damaged, all this can lead to coronary artery disease. It can lead to stroke. And most of us already know some people never recover from a stroke. Some of them live with the consequence or the residual effects for the rest of their life. It can be paralysis on one side of your body, it can be on both sides of your body, it could be, depending where the injury occurred on the brain. You can be paralyzed, you can have weaknesses on one side of your body, and so on and so forth. So those are some things that we should look out for. Choose to manage your blood sugar and keep it, Lady 4, welcome. Choose to manage your blood sugar and keep your A1C under 7. Continue to modify your diet, add more protein, add more fiber, add more healthy fats, decrease your carbohydrate intake, decrease your starch intake, maintain your doctor visits, increase your activity level. Increasing your activity level means that in addition to everything you're already doing, do something else. Add 10 minutes of activity each day. You can start with 10 minutes each day and grow to 11 minutes and then to 12. By the time you do that for 3 weeks, you've built your endurance to about 20 minutes of extra activity per day. And if you keep that up consistently, it will help significantly keep your blood sugar lower. One of the things that impacts your overall health the best is activity, physical activity. So that's walking, that's dancing, doing Zumba. Yoga can help too with mindfulness and just getting body and soul together and improving your overall health while beating diabetes. Friends, thank you so much for being here. Please, let's TAP, let's invite so we can reach more people. We can't keep this to ourselves. We cannot keep this to ourselves, right? Let's share, let's invite, let's engage, and let's do what our hearts desire. I learned that from my friend Dwayne. He said, do what your heart desires. Whatever your heart desires, do that. Whatever your heart desires. The hearts are free, so you can just keep doing this on your screen. It's free, and it's also free to invite people, as well as clicking that plus sign on my name or clicking that red button and turning on your notifications so that you will always know when I'm here or when I post something new. Remember, diabetes doesn't have to lead to disability. When you know that your blood sugar is not controlled, talk to your doctor. Consider, increasing your activity, like we said. Maybe your doctor will adjust your medications. There are a lot of medications out here now that can help in treating your blood sugar as well as helping you lose weight. If you're someone who is obese, consider talking to your doctor about that medication option or those medication options. That way, all things can work together for your good. Okay? Any questions? Don't hesitate to drop a question in the chat. I'm here to serve you. Remember, your health is your power. in everything you do before you take that next bite of carbohydrate, before you take that next bite of starch. Remember that the starch is not bad for you. Your body can no longer process it like it should. So it makes sense if you eat less and less of it. Everybody needs a little bit of starch. Everybody needs a little bit of carbohydrates. But because when your body breaks it down, it converts to sugar. And since your body can no longer process sugar like it should, it makes sense to reduce how much carbohydrates you take. So thank you. That's all I had to cover tonight. In the meantime, I'm going to invite one of our friends. He is going to tell us a little bit about his challenges with type 2 diabetes, and in hopes that it can help somebody tonight.
Morning.
Hello, guys. Meet Dwayne. He's joining us all the way from Guam.
Yes, Alpha Day, thank you.
Yeah.
You have a wonderful
Welcome.
presentation